This is Houston Matters. I'm Craig Cohen. Actor and musician Donald Glover, who also performs under the moniker Childish Gambino, recently revealed he suffered a stroke last year. That led to a pair of surgeries and a hospital stay right here in Houston. His experience revealed a few key things. First, younger adults can face serious health conditions many in every generation tend to wrongly assume are the purview only of the very old. Second, Glover is not as young as some of you think. He's 42, so no longer quite so childish a Gambino. And third, more adults may well be facing more serious health challenges earlier in life. Let's talk about all that now with Dr. Sean Savitz, director of the UT Health Institute for Stroke and Cerebrovascular Diseases. Dr. Savitz, good morning.
Thank you very much for having me.
And as we chat, we welcome your questions or comments for our guest. You can call or text us at 713-440-8870. You can email us at talk@houstonmatters.org. You can also post a question on our video feed. That's at houstonpublicmedia.org or on Houston Public Media's YouTube channel. First of all, Doctor, are we seeing more serious health problems more often earlier in life than we used to?
I think so. Yes. I mean, I came to Houston was 2007, and over that time frame, nearly 20 years or so, I've certainly seen a rise in the number of people who are younger, people who are, let's say, below 60, who are having a stroke. And we're taking care of people at a younger age, with stroke. And that is very alarming because, when we are trained as physicians, particularly in the 90s, we were taught that stroke and other types of, vascular conditions is something that affects the elderly, not so much young people. So, yes, I do think that we're seeing a rise.
Why do you think that's happening?
It's a great question overall, and I think there's probably many different reasons. There's been a rise in high blood pressure, a rise in diabetes, more people with high cholesterol. I think perhaps also our diets and our access and what we eat are important factors in all of these particular areas, to think about. But I think a lot of it has to do with the fact that we're seeing more people with high blood pressure and diabetes and these vascular risk factors.
Is it just stroke, or are we seeing the same sorts of trends with lots of other, what we might characterize as more major health emergencies?
Yeah, I mean, we're seeing a rise certainly in high blood pressure and diabetes. Um, I mainly take care of people with stroke and neurological disorders, so I don't take care of people with other major medical conditions. But I am concerned because I also see, it seems to me that there's an increase in number of people even with neurological and neurodegenerative disorders at younger ages too. So I do think that it's not just stroke overall.
What are, getting back to strokes, some of the common warning signs of a stroke that people, younger adults especially, might overlook?
Well, it's been a really important public health campaign that has got launched back in the 90s and has been occurring over 25 years to educate the public because there are things that can be done for people to give them time-sensitive treatment. So we have had acronyms developed in the United States to think about the signs of a stroke. So there's an acronym that's popularized and promoted by the American Heart Association and other organizations called Be Fast. Each letter stands for a different potential sign of a stroke, where the B is for if you've suddenly lost balance, the E is for your eyes. So think about if you've suddenly lost vision. The F is if your face suddenly, droops or you're having an asymmetry of your face. The A is, for your arm, if your arm, suddenly isn't working or it's dropped down and you can't move it. And then S is for speech. So many people have difficulty speaking or they don't understand what other people are saying. And then the T is for time, meaning that, time is of the essence. We say time is brain, that, every minute that's elapsing after the onset of a stroke, the brain is losing more and more neurons and brain cells estimated at 2 million neurons per minute in a stroke. And so that 911 needs to be activated immediately to go to the hospital.
In Donald Glover's case, during a medical evaluation, doctors discovered he had a hole in his heart. First of all, what does that mean?
Okay. So a hole in the heart typically refers to something we call a patent foramen ovale. It's a very small hole that up to 25% of the population has. Typically this is a flap-like opening between the two upper chambers of the heart. And that usually closes after birth, but stays open in some people.
And how often are such heart conditions? Are they contributing factors to the potential for a stroke?
They can be, and it's estimated maybe that about 5 to 10% of all strokes are due to this condition. But it's not in everybody. So if up to 1 in 4 people may have a hole in the heart, I guess the big question is, so why do some have it and some don't? And one of the issues and factors that we understand is that there usually is a predisposition to a blood clot in the veins of the body, like in the legs, and that clot can then migrate up through the veins, up to the heart, get through that hole, and then when it crosses over to the left side of the heart, then it can then go up to the brain. And so that there usually some kind of predisposing condition that allows for that clot to get through.
You mentioned that we're seeing increased prevalence, as we all well know, in diabetes among young people, in high blood pressure. We're seeing it with high cholesterol, among other things. And we tend to think in terms of, well, that could be addressed through diet and exercise. And to a degree, perhaps it can, through medication, certainly that can help a lot. But how much do other lifestyle factors play into all of this when we're talking about younger adults, however you want to define the age range? Are there other factors in terms of kind of the lives we're leading today that we're not giving enough attention to that could lead to the circumstances that could cause us to someday have a stroke or a heart attack or some other major event?
Yeah, I think it's a really great question. We're seeing that the link between, for example, physical inactivity and diet. There's that link and is been established more and more now with data in terms of the risks for having a stroke or for developing cognitive impairment and dementia over time. The and so it is really, I think, much more of something that's within our power to change in ourselves, and that we can substantially change our risk factors overall to promote better brain health, is what we're calling that. And so that really does entail the idea of, like the American Heart Association saying that you should try to engage in at least 150 minutes of aerobic activity in a week. And when you really break that down, that's just 30 minutes, per day over 5 days. That really can make a difference. That we really should be paying attention to what we eat, and that processed foods and ultra processed foods, there's more data that indicates that that does predispose to higher risk for developing disease in our arteries. And when we start developing disease in our arteries, that's what's predisposing us to stroke overall.
How about sleep and stress? Do they play a role in all of this?
I really think so. It used to be harder to answer that question, when I was first asked these questions years ago about stress, but sleep certainly is now better understood that the importance of sleep. A lot of what we're beginning to really understand about sleep is that it's important for the cleansing of our brain, particularly the air, of how we get rid of waste products out of the brain. There's a biological system called the glymphatic system, which we're getting to have some better understanding of. That's really kind of a newly discovered area within the brain. How does the brain, every organ has waste products that need to get removed and cleaned out. And so sleep is an important, time in our lives in which the brain is basically undergoing kind of that dishwasher that you turn on at night. It's the same thing that you're doing for the brain. So if you don't get enough sleep, then the brain unfortunately can accumulate more waste products, and that can predispose us to many different conditions, not just stroke, but also injuring, our brain. I mean, and that's the kind of thing that's not like it happens overnight, right? It's something that accumulates over time, a long-term, problem that we have when it comes to sleep deprivation. But
There,
I think you're right about that, that sleep really is important.
there's also this growing understanding of the link between mental health and physical health, and that one impacts the other. Are we further tying that into the increased prevalence risk factors for something like strokes? That good mental health has an impact on good physical health, and possibly even could reduce those potential outcomes.
I think at this point that the answer to those questions is more in the answer of yes, versus when I was asked these questions a couple of years ago, it was harder to say, do we have studies? Do we have data? We're not sure, but we're beginning to better understand that mental health is really important, that there's quite a link, for instance, with the inflammatory responses within our body and the brain, that mental health conditions can predispose to more in the way of inflammation, and that inflammatory responses, certainly of the arteries, when they get injured, that again leads us down the pathway for having risk for stroke. So I think that there is now more of a link between mental health and stress and predispositions for risk for stroke overall.
You mentioned earlier that acronym Be Fast, and the symptoms that combined certainly indicate an emergency situation, and the need to get medical attention as fast as possible, which is again the T, the time, and Be Fast.
Yeah.
But I also wonder, when it comes to one of those isolated incidents, one of those, it could be a lot of things, right? And one issue that I think a lot of people have as they are transitioning from that early adulthood into, well, I'm not so young anymore, to, I've reached middle age and then beyond. I won't categorize beyond that. But there is this sense of, well, I have this ache or this pain or this one symptom of a thing. How do you tell the difference between, well, I'm just getting older and this is a thing, and I wake up with a different thing every day, and no, this is something that you need to get checked out?
Yeah. Well, I think if your face is drooped on one side, we should not be thinking that that
Right.
is just, well, I'm getting older.
Granted.
If I can't speak or I've lost vision in my eye, that's an emergency. And it's better to go and get checked out in an emergency room than to just think, well, maybe this will just go away, or maybe it's just based on age. It's better to find out that you're not having a stroke. And yes, it could be an inconvenience that you're going to have your day spent in the emergency department. But this is your health, and a stroke irrevocably changes almost everybody's lives. So I'm always prefer that people, we see a lot of people that will come into an emergency department, and they're worried that they had a stroke, and it turns out that they didn't. And some of them feel embarrassed by that, but we say, and we're so happy that you came, because and that we can deliver the good news that you didn't have one. Um, because the we see so much of the other situation, the opposite, where people had a stroke and they didn't come in time, for timely treatment. And so, but you make a great question, a great point about, how do you separate? And as I said, so we are always in favor of the idea of, sudden symptoms of this sort, are the type that a 911 call, it's better to go or have a loved one take you to an emergency department to be urgently evaluated overall, than to think that, well, this is just part of me getting older.
Is it your impression that we do suss that sort of thing out more effectively as we get older, just through general life experience, and that you can kind of tell the difference between, a headache that's annoying and something that's like, uh-oh, something serious is going on, as an example?
Yeah, I mean, I often have the cases of people who have a migraine disorder, and and they're having a headache. So what we say is, well, if that's your typical headache, that's part of your part of the migraine that you have, okay, we understand that, then that's most likely the case, then it is part of your migraine. But if it's different, the headache type or the suddenness or the severity of it all is something very different than what you've experienced in the past, and that's something to take very seriously, because sometimes it isn't the migraine. So, sussing it out, like I said, or figuring that out, it's better, I think, to be done by a healthcare professional, and sort that out, and then they can give advice about, what to do for the next time that may happen, and try to help them out, because this all, I think, has to be addressed of what you're talking about more at the individual level, and understanding the kinds of problems and conditions, that somebody has, and then helping them to sort out, well, these conditions you're having right now are part of your pre-existing, problems that you have, or illnesses that you've had in the past, versus this is new, and you should always be paying attention to this as something that could be potentially an emergency.
Dr. Sean Savitz is director of the UT Health Institute for Stroke and Cerebrovascular Diseases. Dr. Savitz, thank you very much.
Thank you for having me.